Hello, everybody. I welcome you to Nurse Life TV. I thank you so much for clicking it and for watching it. I hope you take your time to watch this video in its entirety. This one, I can guarantee you that almost all the topics here that I'm going to discuss in this video, you will see in the NCLEX, on the NCLEX, whichever way you want to put it. This one is a 100% guaranteed. And if you have taken the NCLEX before, maybe you are going for your second, third, fourth attempt, comment in under this video, under this video, and let me know if any of the topics I'm about to share here you have seen already. Maybe you are going for your second time. Just comment below if any of the topics I am about to share here dropped. If you remember, if you can remember what you saw on the NCLEX the first time you took it. But if you're a first time writer, I want you to take this advice. Take these topics that I'm about to share with you seriously. I took it from a sister. I wrote it down on a piece of paper. I'm in my car doing this video. I will do this video again in another way. Okay? So I can share the topics on the paper. I'm in my car. The sun is shining on the other side. So you might not see what is written on this paper. But I will try and do it another way where you will see everything, as I wrote it down. But I'm going to just, list them. Please, with the love of God, get you a pen and a piece of paper. As I mention the topic, write it down. Now you can look in the video description. Look in the video description. I'm going to list it all in the video description. So if you are too lazy to write it as you are watching, you can go and copy from the video description if YouTube allows you to do that. Okay? But by all means, I can guarantee you that some of these topics, if not everything there, you will find on your NCLEX, because I did. Yes, I did. So before I move on, share, subscribe, comment, so that you can help this new channel to grow. God bless you so much for helping us build this community. All right, I love you for doing that. Thank you, and I appreciate you. All right, so these are the NCLEX topics. So this video is about NCLEX topics that you should be 100% sure. Be 100% sure that you will see it. Even if you've written it 9 times or 10 quadrillion times, you will see it. Okay? So my advice is that write it down and, compare it with your notes, what you've already studied. That if you've studied all this, this is included in the content that you already know in your brain. Okay? If there's not much of it, please add the rest that you hear me talk about. Okay, so number 1, Addison and Cushing. Addison and Cushing. Know the signs and symptoms of Addison and Cushing's. Okay, know the drugs involved, the therapeutic, and all information about Addison and Cushing's. Okay, especially the corticosteroids that are being used in that are missing in Addison, and that is too much in Cushing. All right, that's why I said I will make another video about this topic, because it's very crucial. It is very, very crucial. This one, I can bet my life on it. Yes, this one, because my other videos, I'll tell you, I cannot guarantee. Okay, but this one, I'm guaranteeing that you see these topics. All right, the second one is chronic kidney disease. Now, under kidney disease, chronic kidney disease, end-stage renal failure, write that with it. So chronic kidney disease, / end stage renal, disease. So add that. You will see what either chronic or end stage renal, one of it, you will see it there. So know the content for this chronic kidney and then end stage. Okay. Cirrhosis is the third one. Cirrhosis. The fourth one, diuretics. Know your diuretics. The furosemide. If you have too much furosemide or you are on it for a period of time, what are the things that can happen? What acid-base balance, issue can you have? Too much of your lysis means you are going to go into hypokalemia. Okay, low potassium. You're going to be peeing everything out. So diuretics. ADH. Know your sepsis. Know everything about sepsis. Okay. Potassium. Know about your potassium. And each role related to drugs. The role of potassium related to what? Drugs. Okay. Emergency cardiac medications. Since I'm talking about the word cardiac, let me chip this in. On the NCLEX that I took, one of the cardiac EKG strips was shown. I only got one, and I'm assuming that I got it right. That's why I didn't get too many of it. I got only one of them. I think ventricular something. Yeah. In fact, I'm not good with those cardiac EKG thing. It's not my favorite subject, nor is it my favorite topic. I really don't like it. I don't hope to work in any cardiac department when I start working in the hospital. All right, so that's that about cardiac medications. Now, for the cardiac medication, a very easy way or simple way of knowing them, you want to listen to McClemic audio, the one that is like 10 hours or so long. And then when you get to that portion where he's talking about the cardiac medications, amiodarone, and what else? Digitalis. What else? He has it. He had it listed in ABCD, if I'm not mistaken. So your beta blockers, your calcium channel blockers, he lists a couple of them that is guaranteed to be on the test. Please pay particular attention to what McClemic taught about those cardiac medications. Okay, learn it, listen to that, but if you can reverse it, that very portion of the cardiac medication and about the asystole, ventricular fibrillation, and whatever not, how you can remember those EKG strips. Pay particular attention to it. It will save your life on the NCLEX. Okay. All right. The next one is precaution. So a lot of precaution was on my exams. A lot of it. Droplet contact airborne. Droplet contact airborne. Now, McClemic also have a way for you to remember your contact, the sicknesses that are for contact, the ones that are for droplet, and the ones that are for airborne. And I remember he saying that hepatitis A, he used A to represent anus. It means it's a contact. So Hep A, meaning it comes through the anus area, inner area, and therefore it's contact. Okay. And I remember simple nursing, Nurse Mike, when I was binging on his video, when I was watching the airborne precaution video, he also have a simple way of making you to remember your droplets and your airborne disease. For the airborne, he said, I am on air on MTV, and M represents measles or so, and then T represents tuberculosis. So MTV, and V is for varicella or your chicken pox. So he has a cool memory trick for you to remember. So Mike really, I really binge on that video because this topic was given to me by a very good sister, and she said, I can guarantee you that these are going to be on there. And lo and behold, they were on there. The day before my NCLEX, I was going through these topics, making sure that I've watched videos, I've read the card that I bought from Level Up RN. Okay, so please go and listen to Simple Nurse Mike video. It might be on his YouTube channel, I don't know, but I was watching it from the membership site. All right, so for the TB, know the criteria for positivity, the chart on vulnerability and no vulnerability. Know all those things about TB. These were on my NCLEX exams. And I was like, whoa, it was like a lottery to me. Like, wow, this sister said it, Then the next one is warning signs of cancer. Warning signs of cancer. Mike also have a way of you remembering. It's inside the membership site. Okay, the next one is Fundusheight. Fundusheight. You have to know the weeks of gestation. Fundusheight. Non-stress test. That's the next one. Non-stress test. NST. Versus contraction stress test. Non-stress test versus contraction stress test. All right. The next one is Preeclampsia versus Eclampsia. So know the abruptio, placenta, Preeclampsia, the Eclampsia, and all the eclampsias that you can think of about pregnancy, maternity. Be sure that one of them is going to come, or more than one of them is going to be on your test. That one I used Summit College. Summit College. That lady is an amazing teacher. She has a thick accent like me, but her content are dope. Oh, forgive me, my camera just shook. Sorry about that. That lady's content is just dope. I binge on it. I made my notes, and I have all these notes that I made from watching Summit College, and it helped me. It helped me a great deal. Yep. I have a book full of notes, and then I also use printing sheet to make a lot of notes whilst listening to her. So if you want to get just a simple way of remembering your Preeclampsia, Eclampsia, abruptio, placenta, watch Summit College. She will break it down very simple for you to write your short points. Changes in the female body during pregnancy. Changes in the female body during pregnancy. I had a couple of maternity questions and pediatrics. Yes. Female positioning and interventions. Female positioning and interventions. Optimize oxygenation. This is all part of maternity. Fetal positioning. Fetal positioning is the next one. Blood transfusions. The steps and criteria. Now, I had a couple of blood transfusion questions, and it was about prioritization. And one of the questions that I remember vividly was the question said that, okay, so the nurse is going to administer blood to the patient, the client, and what can be delegated to the UAP. And so the two answers that I chose was that the UAP can take the vital signs. The UAP can also go and get the blood product from the pharmacy and bring it to the nurse. Okay, these are non-invasive things that she can do, he or she can do. The rest was more of a nursing skill that the nurse has to do. Yeah, and there were other questions about the blood transfusion as well. So take it serious. Take it serious. All the content about blood transfusion, please take it serious. All right. The next one is TPA, total parenteral. Okay, TPA criteria and then screenings. TPA criteria and screenings. All right. So for pharmacology, cardiovascular. Know your digoxin. I had questions about digoxin, the therapeutic range and the toxicity. My questions was on the toxicity and the antidote. And for the antidote, they gave me food options that has the antidote. They said I should list food that have vitamin K. Okay, so don't expect, and it's another video I'm going to make, don't expect the NCLEX to be direct question. When you watch Summit College, the teacher, she said it several times in her video that you are not going to get a direct question from NCLEX. You know, it's not going to be like blue, black to you, straight out questions to you. No, dear, it's not going to be like that. So don't expect a direct question. So instead of they telling me what is the antidote for the digoxin and then just saying, putting in the list vitamin K, they asked me to list the food that has the vitamin K in it. Okay, and then for the MA, the Summit teacher call it MAOI, MAOI medication. Those drugs, MAOI drugs, is a mental drug. It's a psychiatric drug, and you know how you have to avoid foods with tyramine. Now, it didn't come out as a straight question that avoid food with tyramine. They wanted me to list down. They brought a list of food, and then they wanted me to choose options that has tyramine in it. Okay, so know your nutrition. Know the nutrition, the foods that has tyramine, because when you take nutrition content, you will know. You have questions that list food that have tyramine and food that doesn't. So know those things. You by all means meet them. Remember that the toxicity part of a drug is more important on NCLEX than the therapeutic range. Okay, the toxicity and the antidote is what they dwell on. Okay, and they don't give you a direct question. So try to look at it in the reverse manner. Whatever you are learning, try to look at it from a reverse manner. Try to twist the question backwards and see if you will still be able to. If they twist the question backwards, would you still be able to fish the answer out? If yes, then you are going to pass. Yep. The next drug is theophylline. Now, I also watched Level Up RN. Kathy. Her name is Kathy. She said, remember, Theo means God. So too much of Theo means you're going to see God soon, meaning toxicity of it. I'm going to make a video about the top drugs that, I mean, you cannot miss it. I will make a separate video about them. Digoxin, theophylline, lithium, warfarin, a couple of them. Yes. So I will just stress on it a bit in a different video for you. So theophylline, know the toxicity. Know all the symptoms in the toxicity, so that when they put your question in a reverse way, you will still remember it. You can still remember it from there. All right, know your heparin. Okay, protamine sulfate, the antidote. Know your heparin, signs and symptoms of toxicity. Okay, and like I said, I'll keep repeating it. Put the question in a reverse manner. If they reverse it, would I still see the trick? You know, and know every drug interaction too. Now the three that from simple nursing to level up RN and Summit College, their content. Ginger, garlic, and then the other one, I can never say the name. I think it says ginkgo biloba, or say, like something like that, biloba. Yeah, no, the 3 G's. Ginger, garlic, ginkgo biloba. Know them. They interact with almost all the drugs. So anything garlic, anything ginger, choose that one. Yes. All right. So know about pneumonia, COPD, sickle cell crisis. I got a question on sickle cell crisis. Yes. Remember, pain is a priority when it comes to sickle cell crisis. And in sickle cell crisis, if I remember from my notes, I'm going to be going in detail some of the notes that I wrote, that it was vivid in the NCLEX from Summit College. There's a pain medicine you cannot give in the case of sickle cell crisis when the person is in pain. I believe that is Demerol. I'm not 100% sure, but I will recheck and I'll add it in my next video. So pneumonia, COPD, sickle cell crisis. All right. The next one is diabetes. Diabetes, you know, me as a LPN, licensed practical nurse in the nursing home, majority of the residents or the clients we take care of have diabetes. Okay, so you cannot miss a diabetes question. You can't miss it. Okay, so know your hypoglycemia, hyperglycemia. Okay, know the signs and symptoms, the symptoms in a reverse manner, inside and out. You know, if you need to memorize them. There are some things you can't memorize. You just have to understand the concept. Once you understand the concept, you are able to deduce answers for your select all that apply. Okay, but there are things you can never, whether concept or not, you need to memorize them. Okay, for skills, know the ABGA score, know Glasgow Coma scale. ABGA score, Glasgow Coma scale. All right, select when it comes to SATA questions. Let me list these things. And they were on my, I had 56 SATA questions. Select all that apply questions. Okay, meningitis was one. A lot of my questions were meningitis. Select all that apply. Another viral infection, but mine was just meningitis. Okay, and then what is the PPE for meningitis patient? It was rampant on my NCLEX questions. So if you are writing it for the first time, if you are writing your NCLEX for the first time, remember your SATA questions, a lot could be from meningitis. Okay, now remember that meningitis, I believe, is a droplet, so it's a surgical mask. Okay, the airborne is N95. It can be very confusing, so I had to watch the video over and over. Every week I had to watch those videos. Every week I was watching them, and then I try to recall from memory on a piece of paper. Every week, every day I try to recall from memory and to make sure that it has sunk into my soul. All right, the next one is hemorrhage. So 2 types in the brain. Remember, hemorrhage. All right, maternity hemorrhage. You have to know maternity hemorrhage. All right, know your lithium. Lithium and digoxin was just rampant on my NCLEX. Lithium, especially lithium, yes, more than digoxin. I had a lot of lithium questions. Know your toxicity level. Know the signs and symptoms of your toxicity. What the patient should do, you know, to reverse it. And I think about food as well. Yes, malignant hypertension. Know that. Adverse or life-threatening side effects related to psych medications. So if you are learning any of those psych medications, know they are more interested in the adverse effects. the adverse effects, okay, or the life-threatening effects of these psych medicines. So remember how some of these medicines will cause extra pyramidal symptoms where they are rolling their tongue, or those are life-threatening adverse effects. So know those ones. Okay, so for pediatric, know the developmental milestones for pediatrics. Mike, for simple nursing, break this down in an amazing way, a simple way to get it. So if you want to go with Mike, go with Mike, or Summit College. Summit College content is for free. She also did an amazing job with the developmental milestones in the comprehensive videos that she did. All right, the last one I will put here is insulin. Your insulin. Know the onset, the peak, the duration. Now, I think I had only one of it, and that was about the regular insulin. Remember, regular insulin, it is the only one that can be given IV. The only one. I think I had that question. Yeah, I had that question, if I remember correctly. So these are the topics. I am guaranteeing again that you will see it in the NCLEX. All right, adios. I love you guys. Share, comment, subscribe. Thank you.